inside the program, one of the things that really matters to our students is what we call our standardized patient program. In medical school, standardized patients pretend to be actual patients. They come in with symptoms and descriptions of symptoms, and they play a patient so that medical students can utilize their diagnostic skills on non-patients. We found out that as a health sciences university, University of Western States would allow us to do so for mental health as well. So we trained actors to play clients who have mental health issues. And that way, in our preclinical courses, our students actually have the opportunity to engage in clinical services without actually having to worry that they could potentially be causing harm to an actual client. These actors, within the first couple sessions, you absolutely believe you're working with somebody with a mental health issue. So our students sort of forget that they're actors, but it gives them a lot more freedom to try things on and to really practice the skill sets that are hard to learn.
Is this something that is offered in other types of counseling programs outside of ours?
I've taught in 7 before I landed at UWS, 7 different programs, and I haven't seen it utilized in any of those 7. I've done some searching around in the United States in a variety of different programs, and there are some really good programs out there in the world, but I haven't found any that are using standardized patients in a preclinical setting.
What prompted you to develop this as part of the program?
You know, I just remember practicing with my peers when I was in my master's program, and don't get me wrong, these peers enjoy working with one another. They can talk about that process when they get the opportunity to speak. But sometimes our peers are not the best actors, and it's hard to maintain a focus as a client when you're not used to acting. And the reality that these standardized patients really bring into the room, you can feel, it's palpable. Even though that it's occurring over telehealth, you can feel their mental health issues. And our students can describe this process for our guests. But it's just a step above what we would traditionally see as a preclinical experience.
I could see how if something feels more real, then it would feel like it were preparing you better for being in a real situation.
Yeah, and we want our students, this is the hard part. Everybody, and this is me included, thinks, oh, I'm going to use traditional listening skills. I'm just a really good listener, and I'm going to get in there and I'm going to nail this counseling thing. Counseling, although it incorporates listening skills, is such a whole different way of listening that when you first get faced with sitting with somebody who has a mental health issue, you realize, oh, the traditional listening skills just don't cut it here. And they sort of flub a little and they sort of pause and freeze. We want them to be able to do that, right? We don't want them worrying about harming somebody when they do that. So I always get excited when students are in our preclinical courses and they have a little bit of a flub up so they can reset and know that everybody's okay.